Hi guys, I am Paula. It's awesome to see you again. Today we are going to navigate in the deep ocean of the knowledge of nursing to learn heart disease. But listen guys, today I am not lonely. Here with me two experts in this topic. So guys, why don't we start right now? Andres, what can you tell us about circulatory system?
Hi Paula, first of all, I'm so glad you have invited me. So, the first thing you must know about circulatory system is that it has an engine. This engine is the heart. So, the heart has bumps, and these bumps are the auricles and the ventricles. So, the blood is gonna rip through the vena cava to the right auricle, and it's gonna send this blood to the right ventricle to it send this blood to the lungs, and in the lungs the blood will be oxygenated, and then this blood will gonna read to the left auricle, and it gonna send this blood to the left ventricle, and the left ventricle will pumps and send this blood to all the body. So if we have the engine, we need gasoline, and this gasoline is the blood. So what is in the blood? The first thing everybody thinks is the red cells. The red cells are who carry the oxygen and the carbon dioxide to all the organs, and also they have hemoglobin, that is the protein who gives the red color to the blood. And we also find white cells, and they are who kill and identify the pathogenic microorganism. They are our policemen, and we also have our builders. They are the platelets that repair the tissue of the blood vessels when something is going wrong. The plasma. The plasma is like the water for us. Remember that the water is the 70% of water in the most of human, and we have the plasma in the most of human. It is the 55% of the blood. So what is in the plasma? In this sea of plasma, so we have nutrients that alimент the cells of the body, and we have hormones and ions and also gases that help to communicate the organs between themselves. We have now the engine, we have already the blood, we need the blood vessels, our cables to communicate. So the first kind of blood vessel is the vein. The vein are who carry the blood to the heart from the origins. So they have a so intelligent design. So this design have bulbs inside, and it helps to avoid it the blood's return. And when you contract your muscle, it's gonna help to contract this vein and send this blood to the heart. And they are connected with the arteries by the capillaries. So the capillaries are so tiny vessels that allow the gas and ion exchange in the organs, inside the organs. So they are connected to the arteries, the blood vessel that help the that connect the heart with the organs and help the heart to give this blood to the organs. So they help with the strength because they have muscle inside them. So and that's all. So the next is you, Paula, talking about heart disease.
Thank you, Andres. Yes, that's right. This is a big trouble in the public health. But what is this trouble? So the heart disease causes 1.9 million of deaths a year. According to the World Health Organization, uh, cardiovascular disease are a group of disorders of the heart and blood vessels. And the National Institutes of Health define this as injury or disease in the main blood vessels of the heart. So we have to remember that the mainly are caused by a plaque buildup, causing the coronary arteries to narrow and limit the blood supply to the heart. Also, this is known as a coronary artery disease or atherosclerosis. And it happens when a plaque obstructs the passage of the blood to heart muscle, and it can get the necessary oxygen to work. This plaque is called with the name of atheroma. So, signs and symptoms. There are no specific symptoms, so they appear when faced with one of the complications. So, most people who have allowed the disease to progress will experience uh, two types of symptoms. So, the first include pain in the neck, jaw, throat, back, or upper abdomen. And the second is the angina, a kind of oppressive pain in the chest that can be felt in any time it is unstable angina, or is only felt when the person is doing an stressful activity such as exercise is a stable angina. When this disease is not appropriately treated, it could lead to a cardiac arrhythmia. That is when the heart bumps in abnormal way caused by irregularities in the electric impulse. Also, it can lead to angina pectoris, is a type of oppressive chest pain caused by the reduced blood flow in the heart that arrives to heart. In the words of Cates, it can involve in a heart attack, a total obstruction of the bloodstream of the heart that can damage or destroy the cardiac muscle. It is known to as acute myocardial infarction. So, but there is no need to arrive to this condition, and there is some types to prevent this disease. First, remember to do exercise and eat healthy, including varied food in your diet. The magic formula to live forever. Also, remember, go to the doctor to check your blood pressure and levels of glucose and the fat in blood. Now let's talk about the things you shouldn't do. Avoid eat a lot of fat and sugar, and try to never smoke in your life. In your life, those are the actions that will kill your body.
Thanks, Paula. To continue with the topic, I will talk to you about medication for heart disease. We will start with salicylates. They prevent blood clotting. They prevent blockage of the coronary arteries, such as acetylsalicylic acid. We also found nitrates. This can control chest pain due to temporarily dilating the coronary arteries and reducing the blood demand of the heart, such as isosodiazine nitrates and nitroglycerin. There are also beta blockers. Their blood reduces heart rate and blood pressure, reduce cardiac oxygen demand, such as metoprolol and atenolol. Okay, now I will tell you about surgeries of coronary patients. Coronary bypass. The procedure involves taking a healthy blood vessel from one leg, arm, or chest and point it outside the blocked arteries in the heart to improve blood circulation of the heart muscle. A kind of cardiac bridge is made between and another of the coronary arteries, involved occlusion at that point. Cardiac stent. This is an extensible mesh used to open arteries, veins, and other body due and has been worked to improve fluid circulation of the heart method. This method is inserted using a catheter through the femoral artery. This introduction is called cardiac catheterization. Okay guys, that we have finished, and I hope you liked our presentation. See you in the next time, friends.